In Manila's streets they roamed alone, till the mentor's voice gave them a home. From the islands to the globe they flare, wings of care spread everywhere. From night shifts under neon glow to dawns where new potentials grow, with stethoscopes and dreams they soar, bringing healing to distant shores. Nurses rising, lighting flames, heroes carrying countless names. From the Philippines they find their stride, touching hearts and saving lives. In the quiet mornings they recall a guiding hand that moved them all through exams and doubts that pierced their mind. They found purpose, one of a kind. And they wear their scrubs like capes of might, stand tall in challenges day and night. From the barrio to the world at large, leading change with every charge. Nurses rising, lighting flames, heroes carrying countless names. From the Philippines they find their stride, touching hearts and saving lives.
Welcome to the Ray A. Gapu's Review System, your gateway to success. Conveniently located in the heart of the city, we are just a stone's throw away from everything you need. Fast food for a quick bite, a nearby church for moments of reflection, and excellent transportation links to ensure your journey is as easy as possible.
Oh, hello there! Are you ready to elevate your career? My name is Vince Stylo, a registered nurse and a product of the Ray A. Gapu's Review System.
Here, I experienced top-tier review and testmanship training in a comfortable, convenient location. Imagine I learned how to use functional concepts to answer questions in the test with confidence. The Ray A. Gapu's Review System instructional method is superb. Whether you're looking for face-to-face or online review courses, they've got the right program for you. The expert instructors and flexible schedules ensure you get the training you need, when you need it.
Don't wait, join us today and unlock your future.
I started just like you.
After completing my review programs here, I gained the skills and confidence I needed to step into a professional role. Now, I'm here to help you achieve the same success.
Here at the Ray A. Gapu's Review System, it's not just about learning, and it's about growth. And I am proud to be part of this journey.
practice makes perfect. One of the key advantages of our program is the hands-on experience that we offer. Our state-of-the-art simulation rooms lets you practice real-world scenarios in a safe environment. With advanced learning tools, you can build your skills, make mistakes, and learn from them, all before stepping into the workplace. This is how we prepare you for your success.
Here at the Ray A. Gapos Review System, we pride ourselves on providing the best resources available. From books, learning management system, and apps, we have it all for your use. Our curated collection of textbooks and study guides are carefully created to support your learning. We invest in top-notch materials to ensure you get the most comprehensive and up-to-date information. This is how we stay ahead and help you stay ahead.
Enroll today and build the career you've always dreamed of. We're here to help you succeed.
Join us at the Ray A. Gapos Review System and take the first step towards a brighter future. Your success starts here.
Okay, hello. Okay, hello everyone. So, good evening perhaps. Ayun naman, ang ganda ko dito. Charot lang. So, welcome to our study group. So, for today, we'll be talking about cranial nerve assessment. So, gusto ko lang magpakita sa inyo but definitely I'll be turning off my camera after which kasi I think the internet has been fluctuating. So, umulan kasi. So, I'm not quite sure if I could continuously open my camera. So, Taray! Okay, so magandang hapon, magandang umaga or what? Si Junie kasi nasa Amerika yan siya, so it's morning there. Okay, so let's go over and can you please turn off your camera kasi ako yung nai-istorbo. Charot lang. Okay? So magandang hapon sa inyong lahat. So welcome to our NCLEX assessment tuloy. Heche! NCLEX study group. So remember, no, you might be thinking, Ma'am, bakit that's only for NCLEX? That's correct. That's only for NCLEX. But take note, you can also use this, no, in preparation for your local review. So specifically cranial nerve assessment. So basically, tinatanong po yan, no, when you go to your NP3 or NP4. So we have your neurological system yan. So you can also, no, make advantage of this one as you prepare for your local board examination. So good evening again. So welcome to our NCLEX study group. So for today, so this will be a purely discussion. So wala po tayong i-interviewin o so what. So we might finish earlier than expected. Ayan. So welcome. So I am Mentor McLean, Biloquias, RNUS RN, and I'm also the success advisor of the Ray Gapos Service System. So if you have any questions or if you have things you wanted to ask in relation to your preparation, so you might want to ask me or message me. So for those who knew me, of course, you can reach me through my Facebook. And so you can also message me naman with other socials. So if you're following me on Instagram, yan, pwede rin po doon. But most commonly, I could reply through your messenger. So for those who are attending, no, for compliance sake, so please make sure that you are to screenshot the last slide later on for our discussion. So that will serve as your attendance for today's endeavor. Okay? So without further ado, let me close my camera and I'll be writing on the screen. Ayan. So kung close ko na, mag-start na kasi tayo. So, yeah. Close ko na rin kayo yung audio. Charot lang, hindi pwede yan. Okay? So, let's now then talk about your cranial nerve. Ayan. So basically, so these are your three sensory cranial nerves, namely sa olfactory, optic, and vestibulocochlear. So para maiba naman ngayon, So I know most of you here are familiar with your cranial nerves. So ngayon, ang approach natin would be, what now then are your interventions if these cranial nerves are greatly affected? So diba, number one, we have your cranial nerve number one. So we have your olfactory. Ay, kabayo. Siya bumalik doon. Susulat na naman siya mag-isa. Okay. So first in the list, we have your olfactory. Ayan. So tandaan mo. So syempre, when we talk about your olfactory, it has something to do with your smell. Correct? Yan. So pag hindi ka sure kung anong olfactory, just go over to your clothes. No, bahing-bahing ka, maamoy mo yung sarili mo. That's olfactory, no? So take note in the NCLEX or in preparation for any other examination. So tandaan mo, if there would be smell, there would be problem in your smell. So take note. Ang problema dito, if you are able to identify hazardous odor, ability to identify your hazardous odor. So, pwedeng dito, for patients with olfactory problems, safety din po ang iyong priority. Why? Kasi hindi mo alam if for example, you're outside or you're nasa bahay ka with like pipings coming from like a condo unit to which yung gas mo is definitely supplied or centralized. So, pwede kang magkaroon niyan. Like for example, tandaan mo your gas. Pwedeng smoke. Hindi mo na aamoy, may sunog na pala. O, di ba? And then even, malay mo makakain ka ng pagkain sira. Specifically, if you cannot smell your food. Okay? So, tandaan mo if you have anosmia, ibig sabihin, decreased, no? Loss of smell, o meron kang loss of smell. Remember anosmia? Okay, so definitely, ang problema mo dyan would definitely be about reduced safety awareness. So, going back tayo ulit dito because you are not able to identify gas, your smoke, or even spoilage of your food. Now, so ang ating priority dito when we talk about your olfactory is about we ensure food integrity, no? Kasi especially if you don't know if it's spoiled or not, and even fire safety, or in case of gas or smoke. Okay, next, we have your optic nerve. O, diba? Malalim ang, that's how we discuss your study group. Hindi lang dahil sa mga olfactory, ang gagamitin mo lang, other, like for example, your odor, so different sense. Hindi lang ganon. So, what are your possible risks? Next, we have your optic. So, tandaan mo, ang optic mo is about vision and visual fields. Okay. So, syempre, if for example, no, remember your optic nerve is responsible for providing visual input for mobility and safety. So, pag affected yan, pwede kang magkaroon ng blurred vision. Tama? O. Pag affected yan, blurred vision. Okay, what else aside from blurred vision? Peripheral vision is affected. And even blindness. So, of course, will it also increase your risk for safety? Yes. So, dito, kapag meron kang peripheral vision loss, so, of course, ang main priority mo dito would be prevention of fall. Diba? Yan. So, aside from prevention of fall tuloy. Okay, prevention of fall. So, of course, for patients with diabetic retinopathy, tandaan mo yan, no? O, affected din dito. Your diabetic retinopathy. Why? Because take note, your retina, okay, is responsible for transmitting light, no, to be transmitted sa utak mo as nerve or as signals. So without that, definitely wala ring itatransmit sa utak mo. Eh di ang utak wala ring itatransmit or wala silang i-interpret. So that's the problem. Now, next we have